We got to talk about something that is really important, and that's the mRNA vaccines. And joining us right now is President Dr. Bobby Mukkamala, who is with the American Medical Association. Thank you so much for joining us. Hopefully I did not botch your name this morning, and we appreciate you talking about this important topic.
No, you got it pretty darn right, and it's great to be here with you. Thanks.
Oh, good. Okay, so we're already off to a great start. Let's talk about these vaccines and why they are so important right now.
Yeah, there's vaccines for things that we get when we're kids, right? Like measles and mumps and things like that. And you don't know when you're going to get it, but it's good to have antibodies for it if and when you're exposed. And then something like COVID happens and you can get it tomorrow, right? Like it's blowing up in our country. And so we need good, quick access to something that's going to protect us. And we could go for a regular vaccine, which would take a good year and a half longer than it did with mRNA vaccines. And because of the mRNA vaccines, millions of people were saved as far as their lives go. And then probably even more than that, that just didn't have to suffer through COVID and then have, we all see the long effects of having COVID. You stay alive, but you're not healthy. And so it's nice to have a tool to quickly deal with those things. And now that's at risk when all of a sudden, $500 million, we're not going to do that anymore, right? We're not going to study that. We're not going to evolve that. It needs work, but it was great to have it. And now it looks like we might not.
So you kind of touched on it there, but what are your biggest concerns with this funding cut when it comes to vaccine research?
Yeah, it's a big time cut to investigate it, right? Like when something is available, but it could be improved, right? Like even with COVID, right? I remember getting my vaccines and I had to get another one and then another one because the thing was mutating and we needed to update it. How cool would it be to have a vaccine that didn't have to be updated, right? But how does that happen? We're not there yet. How do you get there? You got to do research, right? But now we're saying, you know what? We're not going to do any more research on that. It was bad from the beginning. That's not science, right? That's an opinion of science, but it needs to be scientific. And that's why we need to improve it by continuing the research. And then, it's not just the COVID virus, right? mRNA is something that's been researched to treat cancer, to treat the consequences of having HIV, the Zika virus. There's some pretty cool stuff that it could do. And now all of a sudden, if we're not going to research that, I think we're missing out on something that could truly help us.
COVID-19 really hit us all by surprise. We didn't see that one coming. And here's, I guess, my biggest question surrounding this. There are other diseases that are out there that are maybe in like little small areas right now in different parts of the country that could become a big deal. What does this research, cutting this funding off, if one of those were to pop up, does that mean that the U.S. isn't prepared to handle it?
Yeah, exactly. Because we need something quick, right? When something pops up, like you said, as opposed to kind of being there all the time and in a lesser amount, then we need to be quick about being able to help people in our country, right? And that's what the whole world has to worry about. And now all of a sudden, when you can't be as quick and you're relying on something that's going to take longer, right? We know as doctors and scientists that to do it this way is going to take longer, and to do it this other way, we can go faster, right? And now all of a sudden, those things are at risk. We may suffer, and I don't want to be in a position of being in the United States, and all of a sudden, we don't have an answer. But other countries in the world are sticking with something that's science, right? To investigate and look for other solutions. And we didn't. And what are we going to do? We're going to have to go to them and say, hey, what have you come up with, right? Is there anything we can use? That's not where we want to be as leaders in this world. And that's exactly where we're headed if we don't do our research.
This also brings up the conversation of availability and cost. So should families expect changes in pricing and access when it comes to mRNA vaccines?
Yeah, it's one of those things that if it's not funded, right, and then there's a lack of it, and all of a sudden it becomes something that you have to, deal with your insurance company and say, hey, look, I'd like to get this. And the insurance says, you know what, that's no longer something that's funded. It's not something that the government says you should get, and because of that, we're not going to pay for it. Well, what if your doctor, right? People like me, people like the doctors of the American Medical Association, which represents, the biggest representative of physicians in how we think about taking care of our patients in the country. What if we say we'd like you to get it based on the science that we've learned in medical school all the way through where I'm practicing today, but your insurance doesn't cover it? That's just a terrible conversation to have. But unfortunately, we have to have that with a ton of things like prior authorization and now with vaccines.
Dr. Mukkamala, I guess my question here is, I want to give you a real life scenario. If there is a new COVID-19 variant that pops up tomorrow, there's no vaccine for it, the funding has gone away, this thing is spreading rapidly. What does that look like for me? If I'm, for Gabriella, for you, if we're out here in the world and we can potentially get this, what does that mean on the vaccine front?
Yeah, I mean, if you could potentially get it, we kind of go back to the original way. I mean, think about how we dealt with COVID before there were vaccines. Staying at home, wearing masks if we had to go out, all of that sort of restriction on the freedom that we want to enjoy in this country, right? And that's kind of the direction we're going back when we don't have something that can help you when you do go to work, when you do go to school, right? And that's the consequence of not having a vaccine. And I don't want to go back that way. I'm sure you don't want to go back that way. You want to be able to go out and do what you need to do for your family, for your friends, for your job, and have an immunity so you're not suffering the consequences. And yet, to your question, that's the direction we head if we don't have something to help you when we need it.
The American Medical Association is made up of all types of scientists, all types of professionals that clearly know science better than anyone in the world in medicine. Here's my question. Why has that body, that group of people, been excluded from the new federal advisory group? Is there any indication as of why? And then who has been replaced? Who's there now?
Yeah, well, so the second part of your question, no idea, right? It would be wonderful to have the background to say, okay, yeah, this person has exactly what we would like to see, the research, the life experience, the professional experience to be able to do this well. But what are the consequences for, taking everybody and showing them the exit door and not knowing who's going to replace them? We have a lack of science behind the decisions that need to be made with science, right? And I can understand sort of questioning, I'm not so sure, should we do this, should we not do that? Who do we ask, right? If I got a lump in my neck and I got to figure out, well, do I do this or do I do that? I go to my doctor, right? And so all of a sudden, to have people like from the American Medical Association that publish, in the previous hour you referenced the Journal of the American Medical Association, otherwise known as JAMA, right? This is our science that's out there. But now all of those opinions are shown the exit door and we have no idea whose opinions are replacing them. It's just not a good direction to go for the health of our country.
So doctor, what can patients, parents do to stay informed, if AMA is no longer part of this vaccine advisory conversation?
Yeah, so if we're not, sending this out from a central, intelligent, hardworking group like used to exist in Washington, D.C., where does that leave us? I live in Flint, Michigan. If you're in Chicago, you go to your doctor, right? And you say, hey, look, I noticed that the recommendations they're not really coming out with any. We don't know what's going on there. We saw this news segment on Fox, and we've learned that we should go see somebody. Who do we see? See us. See your doctors, right? But the question is, if you don't have leadership, if doctors don't have guidance from the people that sit down and talk about this every day, then we're relying on our training and whatever we get from our own specialties, which is important. But the more knowledge, the better, right? And that's what we don't lack. So what I would say to patients, talk to your doctor. You guys will do the best you can in the consequence of this sort of decision in Washington, D.C.
How frustrating is this? You're the president of the American Medical Association. I'm sure that took a lot of work, a lot of studying throughout your life to even get to this point that you're in. How frustrating is it to be at this point?
It's very frustrating. And the reason is, I dedicated my career to healthcare in this country because I want to see us get healthier, right? I want to see us live longer, healthier lives. And there are a lot of things we could do from where we are to go in that direction. But to take a backward step like this, to take several backward steps like this, it's disappointing, right? I want to take us forward, right? The American Medical Association wants to improve the quality of life from where we are here, not go backwards and try to get back to where we are here, right? It's a step forward that we want, not a step backwards. And yet, that's kind of what we've been dealing with lately.
Do you have hope that you guys are going to be able to get back on track?
Well, I have hope because of conversations like this, right? I think when our patients, when our communities, when our states, when our country knows what a doctor's perspective is on something, and we can share that knowledge and let them know, hey, this is a problem. We think you should talk to your lawmakers, talk to your friends. Let's get the community, let's get the state, let's get the country going in the right direction. I think that will have influence, right? It's because of conversations like this. So Seth, thank you for having more ears hear the opinion of the American Medical Association.
You're very welcome. I just find it interesting that the American Medical Association has kind of been more of like a research body in some ways. And now it's almost like you have to shift to kind of like an advocate. I mean, you've advocated anyway, but it seems like that because of the state of affairs in our country, it's more of like an advocate role in some ways. Is that kind of how you see it?
Yeah, I mean, so we have the knowledge when we get together in Chicago every summer, and it's the group of all sorts of specialties and all sorts of states that come together to create that policy, and we share that policy with the rest of the country. In addition, we do the research, and that's what JAMA is that I just mentioned, but now we also see as our role helping the public understand why it is that I say something like this, right? It's based on science, and sharing that knowledge with people, I think, will help to sort of minimize the damage from what's been done and improve the chances of keeping our country healthier. And that's our role, the American Medical Association. That's our responsibility.
Doctor, do you think it's a little unfortunate maybe, if we keep on this track, that it won't really be a conversation piece, or, people probably won't be talking about this in everyday life until there is something that needs immediate action, right?
Well, yeah, I mean, that's a bad consequence, but a certainly possible consequence. But we're all about prevention, right? I mean, we would love to keep people healthy so they don't end up in the hospital. How does that happen? When you go in for something, right? I'm an ear, nose, and throat doc. When somebody comes in to see me to get their ear cleaned out so they can hear better, that's a great time for them to ask the question about, hey, I saw this on TV. I saw this on TV in Chicago. What do you think about that, right? That's what we do in our offices. That's how we keep people healthy. And I think we need to make people more aware of being able to ask that question of their doctor, have more doctors available to be able to answer those questions, and focus on preventing disease just as much as we do on when disease hits you, right? And hopefully in a generation, the prevention will make us a healthier country instead of a sick country that gets saved, right? We would love to prevent disease.
Anyone that's watching right now, doctor, if they want to go someplace where they can see, a collective mind of doctors coming together and giving this kind of advice and talking about these subjects, where can they go?
Honestly, it's like turning on your TV and listening to the exact conversation we're having. It's like looking for the things that the American Medical Association puts out there for the public to listen to, right? To learn from. And that's out there, right? And so I would just Google American Medical Association and this year, put Bobby in there, right? And see what pops up. And you'll see our opinion on so many things that we want to keep this country healthier. We want to help the people that are watching and listening to be healthier, and sort of be the counter opinion based on science for what tends to be coming out of Washington, D.C. right now.
Yeah, very interesting conversation and topic. We could keep talking about this
because
really there's so much to it. Dr. Mukkamala, we appreciate you coming on the show this morning, and thank you for really, giving our viewers a perspective that I think they need, and really slowing down the conversation to talk about something that is so important. We definitely appreciate you today.
I appreciate you covering it. We'll see you in June when you come to visit us at the American Medical Association meeting.
We'd love that.